Hello, my name is Dr. John Cangelosi. I'm one of the co-founders of Sagis Dermatopathology here in Houston, Texas. I did my med school training at University of Texas at Houston and then went down to Galveston for both residency and dermatopathology fellowship training. After I finished up my fellowship, I started Sagis, and let's just say it was a baptism by fire. A lot of things I quickly realized that I needed to do to start the business side of things I did not learn when I was a resident or in fellowship. And so it was definitely a big learning curve to come over to learn the simplest things, such as how to start a 1-800 number. So Dr. Yalamanchili is going to walk you through the types of jobs that are available post-residency and some of the things that he had to deal with that was very similar to my experience in starting his own practice. So as you embark on this next phase of your career, please keep in mind that utilizing all your social networks and the people that you've come into contact with throughout your career are going to be important in starting your own practice or joining another practice. We'd also like to be a resource for you in that way. We've actually created a career resource center that's at our website, sagesdx.com/education, that you'll find job opportunities there, people that are looking for great dermatologists and dermatopathologists such as yourself. And most of these are going to be somewhat word of mouth per se. We started as a small local laboratory that's now national in its reach and its reputation. And we have a lot of clients and colleagues throughout the country that are always looking for great dermatologists. And we try to pair them up with residents that are graduating and looking for great jobs. And so please go to that website in order to look at what opportunities are out there. If you don't see something that you're looking for, or there's a certain area of the country that you'd like to be, please reach out to me directly at my email, jcangelosi@sagesdx.com, or at our general email, education@sagesdx.com. And whatever you're looking for, we'll do our best to see if we can help you out. In lieu of that, let's get started. Let me introduce you to a close friend, colleague, dermatologist, and dermatopathologist, Dr. Raj Yalamanchili.
Thanks, John. Hi, everyone, and welcome to our happy hour for today. My name is Raj Yalamanchili. I am one of the dermatopathologists here at Sagis. I am also a dermatologist, and just a little bit about my background. I did a derm residency up in New York and then did my Dermpath fellowship at the Academy. And I actually practiced in a couple of different dermatology settings prior to doing Dermpath full-time. I worked in a very large dermatology group up in New Jersey, and I also started my own dermatology practice, which I ran for several years before deciding to do Dermpath full-time. So I've had a somewhat varied set of experiences, and that was one of the reasons why I wanted to put this talk together for some of the residents a couple of years back, because it's a little bit challenging once you're in your derm residency. Up until that point, all you're doing is thinking about, okay, I got to get into my derm residency. I have to learn all the dermatology. I have to pass my boards, etc. But the big picture is, of course, well, what am I going to do after residency? Residency is simply a stepping stone. So it's, I think, helpful to know what some of the options are coming out of your residency. And some of these are things you can start thinking about now as a resident, because some things do take some planning, and others are just maybe just things to kind of file away in the back of your mind for if you decide to maybe shift gears, or maybe what you start out doing right after residency isn't going to be the last thing you end up doing, and very often it's not. And I'm kind of living proof of that. As I said, I've kind of done a couple of different things, and I've been very grateful for every opportunity that I've had. So without further ado, we'll get started here. So a little bit of an overview of what we're going to be talking about today. First, I'm just going to go through some general info. What are some of the actual options in terms of what you can do career-wise after you've completed your residency? Academics is, of course, one option, private practice, and then there's always the starting your own practice option. So, as you all know, of course, we're very, very fortunate to be dermatologists. It's a very competitive specialty. And if you are watching this and you are a derm resident, then you should already pat yourself on the back, because that's quite an accomplishment. And one of the reasons a lot of people want to go into derm, there's a whole lot of satisfaction in our field. We don't take call, we don't work weekends. We get to see a wide breadth of patients, all age ranges, whatever your interest might be, if it's medical dermatology, surgical dermatology, cosmetic dermatology, pediatric dermatology, dermatopathology. That's one of the things I love about our field so much, is that you really do have so many different areas that you can focus on, do a combination thereof, or just focus on one in particular. Another advantage of this field, it's primarily or almost exclusively outpatient. There is, of course, inpatient consultation dermatology, which many of you probably have to do as residents, and I have a lot of colleagues who still do that after residency as well. But if you choose, you can, of course, make this a almost exclusively outpatient experience for yourself. And again, as I mentioned, the variety. So what are some of the options? So once you've graduated, you can go into academics, of course, and you probably have a lot of experience with an academic institution, because that's probably where you're doing your residency as we speak. You can join a private practice, and that's something that I did out of my residency and fellowship. You could do a combination of both. And then another option, of course, is starting your own practice. Another thing to consider is, do you want to be working full-time or part-time? Our field is one that is amenable to working part-time, more so than I think a lot of other specialties. And I have many colleagues who work part-time, and they've been very happy doing that, and others who do work full-time as well. So it's really just a matter of knowing what your particular needs are, what other considerations in other parts of your life might be. But that is something you want to kind of think about, because that will factor in greatly in terms of what setting you see yourself in post-residency. So let's talk about academics first. So what are some of the pros of maybe considering an academic career in dermatology? There's a prestige factor, I think, without doubt. When you say you're a professor or an assistant professor at a certain institution, I think that carries some weight. If you are interested in research, of course, this is going to be a place where you have tremendous research opportunities, and potentially the resources to help you with whatever project you're interested in, whether it's clinical trials or basic science research, whatever it might be. You already have a team in place to get you busy. If you're joining an academic department, there are staff members already, there are assistants, there are coordinators, there are folks who are already working there who know the system, who can kind of just bring you into the fold, get your schedule going, show you how things work, orient you, etc. There's a certain degree of camaraderie, I think, that exists in academic institutions, probably similar to what you are finding in residency now, except taking it to the next level with attendings as your colleagues. As you're working up difficult cases or talking about challenging cases, interesting research opportunities, whatever it might be. I think that is somewhat unique to an academic setting. You can stay up to date with the latest and greatest of everything that's happening in dermatology. Academic institutions are often where all this research is taking place that we end up reading about in the JAD or the archives or whatever journal you're reading that day. So you do get to kind of stay at the forefront of what's happening in our field, which I think is very exciting. You can also carve out your own niche. If there's a particular interest that you have that's not already being addressed by one of your colleagues in an academic department, that's a great opportunity for you to say, I'm going to be the psoriasis person, I'm going to be the cosmetic person, I'm going to be the acne person, whatever it is that your interest may lie in. You may have a great opportunity to carve out your kind of niche that you focus on. Teaching opportunities, I think that's a huge part of academics. And if you enjoy teaching, whether it's the junior residents right now, or if you enjoy teaching medical students, this may be something to consider. If you find that very fulfilling, I think that's one of the great things about academics. You're going to be training future generations of dermatologists as they come through the ranks. And from a practical standpoint, you're still going to get a paycheck even if you're not there. So if you're on vacation, if you're getting CME, you're still getting paid. And that might sound obvious, but keep in mind, if you are working for yourself, if you're running your own practice, as we'll get to shortly, you're not making any money if you're not in the office. So that's just something to consider. So now that we've talked about some of the pros of an academic career, let's talk about some of the cons. There may not be a tremendous degree of autonomy working in an academic department. You're not going to walk into an academic position and be the chairman. that's not happening on day one. So that is something you need to consider. If you're fine being a part of a team and you don't have to be your own boss and you don't have to be in charge of every last little thing, great. This might be something worth considering. But if you know that you're someone who needs to be in charge, you're calling the shots, you're deciding how to run your workflow exactly how you want to do it, and you don't want to have to answer to someone, this might not be the best situation for you. There is a little bit of a sense of you're working for the system. You're not really working for yourself in a sense, or for a private group. You're working for the university or for an academic institution. There may be requirements that the department imposes on you that you need to publish a certain amount. You need to have a certain number of research hours each week. You may have to present at a certain number of meetings, whatever it might be. Just keep in mind that might be something that I would expect you would have to do in most academic institutions, in addition to whatever your normal CME requirements are, of course, to maintain your board certification and your medical licensure. Across the board, what I found and what colleagues of mine found, and colleagues both when I was a resident and now who are in academics, you will probably have a lower salary versus a private practice job. And there are a number of reasons for that, but that is something to also keep in mind. Again, all of this, you're going to keep seeing a recurring theme here. It's, of course, a pros and cons battle, like what's going to win out, what's more important to you. But do keep in mind that there may be some salary differences. You may have very little say in hiring and firing. So in terms of your day-to-day workflow, as I was referring to earlier, you may have an MA that you absolutely cannot stand and just does not work the way you work, is not jiving with you in terms of your workflow, how you like to get things done, but you may also not have very much that you can do about that. So again, you're not going to be the one ultimately hiring or firing people who you are working with on a day-to-day basis. They don't work for you, they work for the same institution that you work for, so bear that in mind as well. You may have limited time off, some of which may already be pre-assigned for CME. So if you're someone who's already thinking, well, look, I'm going to be working this many weeks per year and I want a week off every month, or I want two-week blocks every 4 months, or whatever it might be for what you're looking for, just keep in mind that may not be possible in an academic institution. Those kinds of things are usually pretty fixed. So just make sure that you know what you're getting yourself into. You also may not be able to do as much cosmetic work if there's already a very large cosmetic presence, being or a large cosmetic presence by another attending or attendings in your department. Cosmetics is the one thing in our field that tends to create some turf wars because, of course, due to the higher return on your investment and the revenue that you can generate from cosmetic procedures, there's, I think, a little bit more of a sense of, okay, well, there's a fixed pool and how many people do we want in it? So if there are already folks who are doing a ton of cosmetics, there may not be as much for you to do without stepping on some toes. So it's just something to bear in mind. And then if the institution makes cuts, undergoes a merger or restructures, whatever it might be, you could lose your job, especially if you're the last one on board. If you were the newest hire, you may be the first to be let go if there are significant changes taking place. Now, again, this would be a very drastic measure, but it theoretically could happen, and just keep that in mind. You are not necessarily in charge of your destiny to a certain extent. It's very different where if you are a partner in a group or if you are working for yourself and you started your own practice, of course. So just something else to keep in mind. So some of the things to consider in talking about an academic position, are you getting a straight salary? Are you getting a percentage of your collections? Is it RVU based? Is it a combination of both? Is there any kind of a bonus structure or incentives? So this will be something to consider in joining a private group as well, potentially. You want to really have a good understanding of what your pay structure is going to be. Are you going to get a base salary, and then if you generate a certain amount of revenue beyond a fixed number that they assign, do you then get a percentage of your overages? Is that based on your RVUs? Is it based on just pure collections? You just want to really have an understanding. I think that in many places, it's often a combination where you may get a certain base salary and then you may get a certain percentage for revenue you generate beyond a certain amount to incentivize you, of course. But you really want to have a very thorough understanding of how you are going to be getting compensated for your work. What are the opportunities for advancements in tenure? I mean, I think most people, when they join a group or join a department, you want to know that you don't just join and then you've hit the glass ceiling within a year. How can you grow? Are there opportunities for growing? Can you become a professor or an assistant professor? Are there ways for you to kind of enhance your position as time goes on and you gain more experience and demonstrate your worth and your value to your department? What kind of PTO do you get? So how much time do you get off per year? Do you get personal days? Do you get sick days, etc.? Do you have dedicated research academic time where you do not have clinical responsibilities? Is it a half day a week, a day a week? Is that even something that you want? Is it something that's expected even if you don't want it? Again, these are all things that you want to hash out. And then again, as I alluded to earlier, research and teaching expectations and responsibilities, you want to have a very clear understanding of what is expected of you. And I would say this is germane to a conversation about any job that you're taking out of residency, or really any job in, I guess, any field for that matter. Really have a very, very clear idea of what is expected of you, and have an idea of what do you need to do to be able to advance in your position, in your career. The last thing you want to do is sign on to something and then once you get there, find out that, oh, wait a minute, I didn't realize I had to do research a day and a half a week, or I didn't realize I had to run these resident clinics, or whatever it might be. The time to figure that out is not after you've signed on the dotted line. All of these are questions that you need to be asking at the very beginning stages of you even considering a job seriously. Know what you're getting yourself into, so that you have fewer surprises down the road, and so that it's a win-win situation for all parties involved. Whoever is hiring you, they want to know that you understand this so that you will hopefully deliver on expectations. And you, as someone joining them, you want to know you're delivering on expectations so that your employer is happy as well. You want to know if you need to do inpatient consultations as well. What are those responsibilities? Are you going to have to run around the hospital seeing patients with the residents? If that's something that you love doing, fantastic. If not, maybe you want to know about that beforehand. And again, I would expect that there may be some component of that when it comes to an academic institution, but maybe there's already an attending or two attendings who already cover that. So you just want to know what are those responsibilities, because remember, that would be work that is taking place outside of your normal clinic responsibilities, outside of your dedicated research or academic time. So just bear that in mind. How many clinics are you going to be responsible for running, and where are they? Are you going to be going all over town to 5 different clinics, 5 half days a week, or are you just in one particular clinic? Are you only staffing resident clinics, or are you running your own private clinics and a resident clinic? So again, getting back to the whole, really get this information in the beginning. The more you have in terms of information, the better you're going to be at making an informed choice for yourself. And then lastly, what start date are they considering? Is it before or after your boards? And do you need to be board eligible, board certified, one or the other? Do they have a preference? And this is actually an important point. Back when I was taking my boards, there was just one date for the boards. It was in August. So most of my colleagues, they had start dates of September 1st because the boards was in mid-August and they just wanted a couple of weeks to get settled before they started their job. I went straight into a fellowship, so it was a little bit different, but you really want to understand, well, okay, if you're expecting me to start the day after I graduate from my residency, how am I going to manage studying for my boards, preparing for my boards? And I think a lot of places would be understanding about the fact that you'd want to start afterwards, but again, you don't want to take anything for granted. You want to have all of this hashed out beforehand. So let's shift gears now that we've talked about joining an academic setting. What about joining a private group? And this is one of the things I did right out of fellowship. So what are some of the pros of joining a private practice group? Well, for starters, you may make more money right off the bat. So that's always a great thing, especially if you're coming out of med school and residency and you have tremendous loans to pay off. This may be something to factor in. Or simply, if you just want to be making more right out the gate. You may also have a greater opportunity for advancement. Ask about if there is a partnership track, or is there some kind of equity that's going to be involved? Can you buy into some kind of equity? Are there stocks in the group, which is basically a company? Are there stocks that you can either be eligible for after working a certain amount of time? Can you buy in? So those are all things that you might want to ask about. You may have more say in day-to-day operations. If you join a private group and you're producing a lot and you demonstrated you're a very valuable member of their team, they may take you very seriously, the partners that is, or your bosses, in terms of, well, look, I find that my workflow works better if this. I need a scribe. I need more MAs because I like to run 3 or 4 rooms at the same time. I need whatever else it might be to improve my productivity. Because at the end of the day, if you're more productive, you're seeing more patients, you're generating more revenue, it's better for you. And make no mistake about the fact that it is better for your employer. So if you've demonstrated your value in that sense and your efficiency, you may have a lot more clout when it comes to asking for certain things in terms of your workflow. You may be able to keep more of what you make, especially if you do a lot of cosmetic work. Many private groups, the private group that I joined, I had a relatively low base salary, but I negotiated that because what ended up working out better for me was that I got to keep more of what I made. So the average where I was, most people tended to keep, I think, 40% of what they earned. I negotiated my contract up to 50% of what I made, but then I had a lower base salary. So that ended up working a little bit better for me because I did more cosmetic stuff and I did more procedures. So it ended up working out a little bit more to my advantage in that sense. But the bottom line is you may be able to negotiate a deal where you keep more of what you make. So the work you do is directly correlated to what you end up taking home in your paycheck. You may get to see a higher volume of patients. Typically in private groups, volumes tend to be fairly high, especially in busy groups. And that, of course, is better because the more volume you see, the more revenue you're generating. And honestly, just from a medical standpoint, I think it's just more interesting. You're seeing more pathology, you're seeing more conditions, you're becoming a better dermatologist and getting to see a lot more variety of what you're doing. You may be a little bit more limited in an academic setting in that regard. But most private groups, they want to kind of pack in those schedules so that you're seeing a lot of folks. You may get more time off. That's a little bit more debatable. I really think that depends on what private group you're in. You may negotiate that each year you're there, you get a little bit extra time off. And in general, I think that people who I know who are in private groups do tend to get a little bit more time off than they do in an academic setting. But again, I think that's a little bit more of a hazy area. It really depends on the specific situation. Day-to-day issues are handled for you if you're just working for the private group. And I think some of this applies when you're in an academic setting as well. You basically clock in and clock out. If there's issues with personnel or with supplies or with issues that just generally have to do with the practice and not so much your patient specifically, that's going to be getting taken care of. That's not your responsibility necessarily. However, if you are in a partnership track and someday you do become a partner, of course, yes, you will have to be involved in those decisions as well, as that's part of your responsibilities. You'll still get a paycheck even if you're not there. It might be for your, your base salary. So if you're getting a large percentage of your revenue based on what you're actually generating in terms of revenue, obviously if you're taking a ton of vacation, you're not going to be making as much. But you're still going to get a paycheck. Your baseline, your base salary paycheck, you're still going to be getting even if you're on vacation, if you're going to meetings, whatever it might be. And then another advantage, and this was certainly true for me, you learn a lot of ins and outs of how private practice operates. I observed a great deal with my boss, who was very helpful, saw how things work, because one thing across the board I will say is the life of residency is very different from the life of clinical practice outside of residency. Academics might be a little bit more similar because you probably have a taste of it as residents already, but when you're in private practice, it is very different from when you're in an academic setting. And just learning about billing and coding and all kinds of other things that will be relevant to you that help you become a more efficient clinician, help you bill more accurately. You don't want to overbill, you don't want to underbill. You want to learn kind of the nuances of how to run your day-to-day operations. And if that's something you're interested in and you do join a private practice, I would strongly encourage all of you to learn as much as you can. Because in many ways, those day-to-day, how do I do this, how do I do that, those lessons, I think, start to become as important as the actual medical part of what you're doing, which you've already been trained to do. I feel that this part is something that many programs tend to lack in residency. So that's certainly an advantage of being in a private group as well. So we talked about the pros. Let's talk about some of the cons now. So you may not have too much say in your schedule. You may be overbooked. And that was certainly the case when I joined a private group. I walked in on day one and I had 8 patients scheduled an hour, which might not sound like a lot, but when you're a resident, you're probably not seeing, unless you're in a super busy clinic and you're a very efficient resident and your other residents are happy with you seeing more patients, you're often not seeing that much, but it's a lot to be seeing that many patients and running multiple rooms. And oh, I have a biopsy in room 2. Oh, I have a Botox in room 3. I have an excision in room 4. You learn to become very efficient, but just keep in mind, if you're working for a group, their goal is still to make money off of you. Remember that. As much as it might benefit you to make more money too by doing more, but you're still working for them and they are making something off of you. So you may be quite booked. Now, ideally, you're going to be able to have a conversation with them before you even start to say, look, this is about what I'm comfortable with in the beginning. Let's see how that goes, and then maybe we tweak it. But if you're only thinking you want to be seeing 2 or 3 patients an hour, this might not be the best kind of, I guess, place to start out of residency. Again, as I said, your practice is seeking to make money off of you. That is just a fact of the matter. That's just good business sense. So don't feel like you're doing something terrible by doing that. They need to make money too, but also don't be naive to the fact that this is in fact the case. Partnership, just forward. Partnership may not even be an option, even if you want it to be. Or if it is, there may be hurdles and there may be potential buy-in, and usually buy-ins are not cheap. So just keep that in mind. These are questions you need to be thinking about and asking before you ever sign a contract. And that's a point you probably already noticed. I keep coming back to it over and over again. You have to know what you're getting yourself into. I cannot stress that point enough. If it's not in writing in your contract, that discussion never happened. I don't care if you shook on it. I don't care if the people hiring you said, oh, don't worry about it. You need to know that it's in writing, because that means it is binding. So know what your options are. Maybe you don't care about being a partner, or you don't want to buy in. You're happy clocking in, clocking out. Great. But if that is something you think is going to be important to you at some point, even if it isn't at the first moment you sign up, you need to talk about that. And you need to know, what are the options? Is it even an option? And how would that process look? And over what time period? Is it a 1-year option, 3 years, 5 years, 10 years? You just need to kind of know what you're getting yourself into in that regard. And then lastly, if you leave a private group, you're probably going to have a restricted covenant. I'd be shocked if you don't. So your patients may not follow you to wherever you go. So just keep that in mind. You are going to have a non-compete clause or a restricted covenant in your contract. So just make sure you know exactly what it is. Because if you say, for example, join a private group in your dream location, right by where you want to live, and you've got a house there and you're all set up, what if then you find out a year in you hate the group that you work in and you don't want to work there? Well, you may now have a 10-mile or even a bigger radius outside of which you're going to have to work, because you can't work within that bubble anymore. So now suddenly you are living closer to your old job, potentially very far from your new job. Just factor in that these are some possibilities in terms of how things may shake out. So again, just understand what the reality might be if you decide to leave that group, and where you would potentially have to start looking for work, and how might that affect your living situation as well. So again, some things to consider. Are you getting a straight salary, percentage of collections, or a combination, just like we talked about with academics? Also, like we talked about with an academic job, bonus structure, incentives. I think we touched on that already. Something that's a little bit maybe more unique to your private practice setting: who pays for products that you use, for the consumables? So for example, let's say you're going to be doing a ton of Botox. Is the practice paying for your Botox, or are you paying for that? And that gets deducted out of your revenue. Is the practice going to be paying for your fillers? Is the practice going to pay for your chemical peels? Is the practice going to pay for usage of a laser? Or are you paying for all of these things? You want to understand all of that going in, because you don't want those surprises later, because you may find that, well, wait a minute, I thought I did X number of patients with Botox and I injected this many units over, say, a month period. How come I'm not getting what I'm charging for it? Well, because there's probably some of that getting siphoned into the cost of the product. So you just need to understand who's paying and how much are you paying, and find out, okay, well, what is the practice actually acquiring these products for? What is the price that they are paying these companies, whether it's Allergan or whoever it might be? What are you paying for the product? What is the practice actually putting down? And is that exactly what you are paying as well? Or is the practice charging you extra for using the Botox that they have purchased? You'd be surprised how many little places there are to kind of make money when you're running a practice. So just be very clear on who's paying and who's paying how much. Again, as we talked about earlier, is there an opportunity for advancement or partnership? Really understand what those requirements are, if it's even an option, is there a buy-in, et cetera. What kind of PTO and CME time are you getting? Is it as much as you want it to be? Does it increase in amount each year that you've been there? Is there just kind of a cap on it after a certain point? Just make sure that you understand how that all works. Call schedule and responsibilities. This tends to not be as much of an issue in a private practice in a dermatology setting because we have very few true emergencies that require you to go in to see a patient in a hospital. But in a large group, there probably is still a call schedule where you need to return patient phone calls or, deal with prescription refills or prescription questions, whatever it might be. So understand what that schedule is and what their specific responsibilities are. Do you get reimbursements for things like your medical licensure, CME, professional memberships, books, reference sources, journal subscriptions, whatever it might be? I've found from people I've talked to and from my own experience, there's usually some kind of a stipend for this kind of stuff, but just understand what it is and how much it is and what happens if you don't use it for a given year. Do you just lose it or does it get pushed to your next year? And that's something to also ask, I'm sorry, by the way, about your PTO time and CME time. Can any of that get rolled over or is whatever it is for that calendar year, whatever it is? And if you don't use it, you lose it. And similar to an academic setting, if you're joining a large private practice group, they may have numerous clinics and locations. So just find out, well, what are my responsibilities? Am I in a different clinic every day? What if I just want to be at the main home-based clinic? That might not be an option. Just find out where you have to be. And again, is that something that's subject to negotiation down the road? Will you be able to change that? If you don't want to travel so much, those are all things that you can at least address before you start and hopefully negotiate. And again, as we mentioned earlier, your start date. Do they want you to start the second you finish your residency or do they want it to be after your boards? Does it need to be after you've passed your boards? So is it enough to just be board eligible or do you need to in fact be board certified? So again, something to clarify. You don't want to find out after the fact that they expected you to start on July 1 when you were thinking you're going to be starting September 1st. Again, know about your restricted covenant or a buyout of your restricted covenant, just in case you end up leaving a group. Is it going to be so prohibitive that this job just makes no sense for you? Because they're basically saying, well, you can't work anywhere in this city. You just, again, want to have a very clear understanding. And I would recommend that whatever contract you get from whatever job you're looking at, whether it's an academic job, a private practice job, whatever it might be, have a healthcare attorney review it. You might think that you have it down and you understand the lingo, and you very well might, but I have found, and every one of my friends and colleagues who've done this before have all unanimously agreed, a good healthcare attorney can help you ask questions that you wouldn't even think to ask, and maybe put verbiage in that protects you a little bit more. At the very least, have someone with that level of expertise look over your contract so that you know exactly what you're getting yourself into and you already know what some of the potential pitfalls are if you do decide to sign with a particular group. So now let's talk about starting your own practice. Now, this is something that I did after working in a large group practice for a couple of years. So let's talk about some of the pros. You're the boss. First and foremost, probably the most obvious one, you call the shots, you have autonomy, you decide how you want to run the show. So if that's something that fits with your personality and jives with your personality, you're not someone who wants to have to take orders or, be accountable to someone else or anything of that sort, and you like to design things your own way and run a ship a certain way, then this might be something to consider. You can build your practice exactly how you want to. Literally in every aspect. How do you want your exam rooms to look? How do you want them stocked? What do you want your logo to be? What do you want your color scheme to be in your office? How many patients do you want to see every day? How much staff do you want? What equipment do you want? What kind of suture do you like to order? What kind of gauze do you like to use? I mean, I know this sounds like an exhaustive list, but you'll find that you may like practicing a certain way and that if you're able to compromise and you're okay, oh, I don't care what suture I use, I just want to get the job done, I don't want to worry about those details, then maybe this isn't your cup of tea. But if you're the kind of person who says, look, I have what I'm doing down to an art, I know what I'm doing, I like doing it this way, this works for me, then maybe this is something to consider because you do have the autonomy to make those decisions. You get to see the patients you want to see. You get to structure your schedule as you choose. You can decide on hiring and firing. You get to create the office policies. So for example, you may say, you know what, I did some PD derm when I was a resident, but I don't really want to see children. It was really hard seeing kids and then dealing with parents, and it's a lot more than I really want to deal with. So maybe you just want to see patients who are 18 and up. You only do adult dermatology, or you only want to see certain age ranges, whatever it might be. You can decide how you want to do that because it's your practice. You can structure your schedule however you want. You want to work Monday afternoons, Tuesday mornings, take off on Fridays, whatever you want to do, that's on you. That's totally your choice. You can decide who to hire and fire. Your office policies, you decide how this company is going to be run, how this practice is going to be run. That all comes down to you. You can take time off whenever you want to. You can call up one day and tell your assistant, hey, clear out my schedule because something came up, blah, blah, blah. I wouldn't recommend doing this very often because that does not tend to build good relationships with your patients. But if something does come up, at least you know you can. If you want to take a certain amount of time for vacation, you know you have something you need to be out of town for 2 weeks at a certain time of year, no one's telling you, well, no, you can't do that because someone else already requested it, or no, that's just not possible. You get to make those decisions. Now, that being said, there are going to be some caveats, of course, which we'll get to momentarily. You can make changes as you see fit. So as your practice is growing, you may find that, you know what, something I'm doing is not working as ideally as I would like it to, or I feel that I could be more efficient if I did this. You can make those changes. It's a process. It's a growing process, and you can adapt as you go, and you're the one, again, making those decisions. So again, you have that autonomy. You set the tone for the overall practice. Is it a very friendly practice that's extremely welcoming? You always say yes to patients, and people love coming there, and you set a tone with your employees as well, that you all have maybe a very kind of friendly environment, and everyone wants to come there, work hard, but also have a good time. Or if you're the kind of person who's like, look, nope, I want a very regimented practice. I want it to be like this. Everything needs to be very precise, and however you like to do it, it all comes down to you as the bottom line. You choose how you want to set this tone going forward, both for your patients and for your employees. And very importantly, I think, you're building something from scratch, and there is a tremendous sense of accomplishment once you do. It is a huge undertaking. I will not kind of diminish that aspect of it. It is a lot of work. That is absolutely true. But once you've put in that work and you've seen that you are building something, and that you have built something from scratch, I think it is a truly, truly incredible sense of accomplishment. And then you train your staff to function the way you want them to work so that you can optimize your workflow. You train them exactly how you like to have things done, and how you like a room to be set up before you go in, what kind of histories they're taking from patients, what information you want them to get from patients, what are all the spiels they need to be ready to give a patient for, oh, okay, after a biopsy, this is what I want you to tell them in terms of their wound care, or after a cosmetic treatment, or in terms of how to take certain medications, or whatever it might be. You can train your staff exactly how you want to, so that they are basically truly extenders of your care. So we talked about some of the pros. Let's talk about some of the cons now of starting your own practice. One of the big ones is cost. It's not necessarily cheap, and if you're coming out of residency, as many people are, after med school and residency, you have tremendous loans. That's something to take in mind. Do you want to go more into debt? It takes time to get established depending on where you're setting up a practice. Now, if you're in a place that's extremely underserved, you may find that within a couple of months, you're already very busy. But if you're in a place that has a lot of dermatologists already, it might take a little time for you to get your feet wet, get people to know you, and to kind of establish a regular patient population that's coming to see you. The buck always stops with you. That's both a pro and a con. If you always love making decisions, that's great. But if you're the kind of person who sometimes gets sick of making decisions, unfortunately, too bad, because you are the decision maker. So you have to take accountability for whatever is happening within your practice, good and bad. Decisions are going to ultimately come to you, to your doorstep. Your overhead doesn't change just because you're not there. So this is something I was alluding to earlier. You can take plenty of vacation if you want, that's great, but you're still paying for your rent, you're paying for your employees, you're paying for your equipment rentals, you're paying for whatever it might be. So if you're not in the office, you are essentially losing money. So that was something I struggled with in my practice in the first couple of years. I just never wanted to take a day off to spend with my family, because I kept thinking, my goodness, well, my overhead's still there. We're not busy enough where I can afford this. So it is a bit of a balancing act. It's very important to take time off for your own well-being, mentally, physically, whatever it might be. But you're probably going to have a voice in your head also saying, well, I don't want to take too much time either, because I need to be in the office seeing patients. You need to deal with all of the administrative duties, or at least make sure they're getting taken care of. So whether you're outsourcing to having an office manager, which you may not be able to do right out the gate, because again, where's your revenue coming in where you can even pay someone to do that? So you're going to have to deal with all the kind of, some of the mundane stuff that you have to deal with in running a business, whether it's ordering supplies or paying the bills. Is your internet working? Is your whatever it might be. That's going to, again, fall on your shoulders. So if you're not the one taking care of it, you're going to have to hire someone who's going to take care of it. But one way or the other, it's going to need to get taken care of, and that's going to fall to your shoulders. You need to be on top of your billing and collections. This isn't like when you're in an academic center or joining a private group where they already have their own in-house billing or whatever it might be. This is your baby, this is your company, this is your ship. So you want to know what's going on with your billing and collections. Number one, so that you know it's being done properly. Number two, so that you know you're not being taken advantage of by anyone along the way. And number three, so you know what's actually coming in to your practice, what's coming into your company. You can then plan for, well, how do I plan to grow then? How can I improve my efficiency? You need to have these checks and balances for yourself. And the only way you're going to be able to do that effectively and efficiently is to really understand every penny that's going out of your practice and every penny that's coming in, and understand the EOBs. I used to look at every single EOB that came in from every insurance company on every patient that I saw. The advantage is you also have the time in the beginning because you're not seeing 60 patients a day, but you really do need to take the time to do that so you understand all the business aspects of your own practice. You need to build your presence and your reputation in the community, and this is something that takes a little bit of time. That might mean going to every possible referral source in your entire community, and I did that multiple times. At least 3 times a year, I would clear out my schedule for a day and go visit every family practitioner, every internist, every OB, every urologist, every surgeon, everyone I could think of. I would just stop by, take them some pamphlets, and just, reintroduce myself again, meet their staff, and just let them know that I was there and ready and willing to see any derm patients that they had that they wanted to send to us, and that we would do our best to get them in ASAP the same day if possible. It always goes a really long way when you take the time to go meet your referring physicians, see them in person. They see that you've taken the time and effort to meet with them, to tell them you're there to help them in any way that you can. Their staff certainly appreciates it, because ultimately get in good with their staff, because they're the ones calling your staff to get referrals in ASAP. So I think that a little bit of that goodwill goes a really long way. I'll take it one step further and say, when you do get patients who are referred to you, take the time to send thank you letters to your referring physicians, along with the synopsis of the patient's visit, what your thoughts were on their care and what your plan is. But don't slack on that, because that really does go a long way. And I think it really builds some really good relationships with your fellow physicians in your community. Be prepared for the fact that this is not going to be a 9-to-5 job. You are not going to be clocking in, clocking out. You will be working after hours and on weekends. That is part and parcel with starting your own practice or starting your own company in any industry, I would think. So just be prepared for that. So some things to consider. If you want to work part-time, you may not want to be starting your own practice. It's a lot to do if you're only thinking that you want to be working, say, 2.5 days a week, 2 days a week. You may find that your time is better spent working for a group. You may not make any money in the very beginning when you're starting out. And it just takes time, as I was saying earlier, to really build your brand and build your practice and have people know that you're there, and have patients tell other patients, oh, I love Dr. So-and-so, and you should go see that person if you have any derm concerns. But the flip side is, while you might not be making very much or anything at all, you might be losing money in the beginning, quite frankly, when you start out on your own, your ceiling may be much higher than if you're in academics or joining a group, because you can grow your practice as much as you want. What you put into it's what you're going to ultimately get out to it. And there's no one saying, well, this is the farthest you're going to get. It's your baby. You can do what you want. So you may really be able to reach for the stars in ways that you couldn't in another setting. As I said, what you put into your practice is what you get out of it. It's not going to someone else and then you, or you just get a small percentage of it. There's less teaching in private practice, typically. So if teaching is something that's very important to you, you may want to bear that in mind. Let's say, for example, you have a very huge cosmetic presence and you have residents in the area who say, oh, hey, can I rotate with you? Just remember, in a lot of private practice settings, many patients, especially patients who are paying top dollar for some cosmetic treatments, they may not want a resident or a medical student in the room with them. They're paying their hard-earned money to see you and get your expertise. They may not want other people in the room. And that could apply to medical dermatologic concerns as well. So just bear that in mind. If teaching is very important to you, this might not be the ideal scenario. There's greater risk and more uncertainty in the beginning with your own practice. I think that's probably a message that I'm getting across here over and over again. But then I want to make sure you're also getting the message that I don't know many dermatologists who start out on their own and their practices didn't make it. People need dermatologists. This is a competitive specialty for a reason. We are in great demand. People are always trying to get in to see a derm. It just may take a little bit of time for you to get to the point where it's a kind of a well-oiled machine and patients are regularly scheduled. Your schedule is packed for like 2 months in advance and that kind of thing. So it just means you might need to be a little patient. So let's say you do want to start your own practice. What are some of the things you need to start thinking about? Well, the first, where do you want to set up a practice? So one of the things that I found very helpful when I set up mine is talking to primary care physicians and other referral sources, calling offices, visiting offices, and just saying, hey, I'm a new derm who's either moving into town or I'm looking in this area. How long does it typically take you all to get your patients in to see a dermatologist? Sometimes they may say, oh, we have a lot of great derms, we can get them in within a day or two. Maybe that's not the perfect place for you to set up then, because they can get their patients treated very quickly. But in the place where I set up my practice, I was hearing over and over again from so many different doctors, oh my gosh, it takes 2 months to get into a derm, it takes 6 weeks to get into a derm. We have so many patients that are waiting and so on and so forth. That's a good sign. That means you're in demand and you haven't even set up yet. They are looking for a place where they might be able to send their patients sooner. And I had many doctors saying, are you already open? This is when I was just kind of doing some recon, just kind of testing the waters, seeing what the situation was. So I knew that at least there were going to be people who wanted to send patients right out the gate. Talk to hospital physician liaisons. You're likely going to have to be credentialed at a hospital, even if not for true admitting privileges, because we're an outpatient specialty. You're going to have to be credentialed for insurance companies to get on some contracts. So a lot of these hospital physician liaisons, they are the one that I worked with, she was absolutely phenomenal because she knew every doctor who's credentialed at the hospital. So she talked to them and she took me to many of these offices herself to say, hey, we have this new derm coming on board and he's ready to see patients as of such and such date. So please keep him in mind. So they can be very helpful too, because they can also tell you, well, you know what, we already have 10 derms on staff. So this area is saturated. You don't want to come here. Maybe you might want to look at this other hospital at another place, for example. And another thing to do, call local derm offices and just ask them about wait times and prices for various services. Obviously, you're not announcing the fact that you're a dermatologist, but you could be a prospective patient. Find out, hey, I want to come in. My kid has acne. How long would it take to get in? Oh, I want Botox. Oh, I want Juvederm. How much would one syringe of Juvederm cost? How much would a glytone peel cost? These kinds of questions are very helpful because it gives you a sense of the lay of the land. I did that when I first started my practice, and I got a very good sense of, oh, so this is what all of these practices in like a 10-mile radius charge for Botox. So I don't want to be the one person charging $8 more per unit because no one's ever going to come see me, but I want to be competitive with the others. So it just kind of gives you a good idea of what the lay of the land is, how long it takes to get in to see the other docs, the other derms in your area, because you want to try to give yourself whatever competitive edge you can, obviously, because there is competition out there, and you do want to be able to set up your practice and start seeing patients and get people to want to see you. So this is a way to do some more background research. Then you need to think about finding some office space. The one thing I will say, and I know a lot of people who have made this mistake, don't get more than you need initially. I know everyone's dream is, oh, well, I want this enormous, beautiful practice, and I want it to look like my old attending's private practice who had like 8 rooms and it was state of the art. They had every device, every this and every that. That does not make any sense if you are just starting out from scratch with your own practice. You might need a couple of exam rooms, a small little waiting area. You don't need much to start your derm practice. Start small, minimize your overhead. You can always expand into another space if you need to, but you don't want to bite off more than you can chew and then be sitting there every day stressed that you're not filling in these rooms. So the analogy that one of my attendings always gave me was, yeah, everyone wants to work in a 4 Seasons, but you need to kind of deal with the fact that you might be starting out with a Motel 6. And I always really like that analogy because it's true. A Motel 6 is still going to get the job done. I mean, you still have a place to go lie your head at night and sleep. It's functional. Might not be the most luxurious, most beautiful place in the world, but that doesn't matter in the beginning when you're just trying to start out. But if you start out somewhere small and then you're able to grow and grow and grow, eventually you never know where you may land. And you may have the office of your dreams, but in the beginning, minimize your overhead. Next question you want to ask yourself is, well, when are you planning on starting your practice? And the reason you need to ask this is you need a lot of advanced planning. This isn't the kind of thing you can decide June 15th of your 3rd year of residency that, yeah, I want to start a practice and I want to be up and running by August 1st. That's probably not going to happen. So you need a lot of advanced planning. You need to make sure you have a medical license in the state that you want to practice in. Now, if you're staying in the state where you already are practicing now, or where you're a resident rather, then that's great. But if you're moving to another state, which is something I did, then that can take months. So just keep that in mind. You need a physical address of an office before you can start applying to get on insurance plans. So bear that in mind as well. And it can take months to get credentialed, especially with CMS. Back when I was applying, it took a minimum of 6 months. It might be taking longer now. Now that we're living in the times of COVID, it could take even longer than that. So just bear that in mind, that this is not a quick process. It does take time. So now the hows of starting your own practice. Okay, financing. Realistically, on average, and this is from not only my own experience, but from colleagues of mine and former friends and co-residents who have done this, I think you need about 100, 200K. And you may get these funds by means of a business loan, which I think is what many people do. If you're lucky enough to have personal savings or contributions from family or friends, that's great, but you're going to probably need about that much to at least get started. Plan for the possibility that you will likely not be taking home a paycheck for several months, might be even a little bit longer, but you still need to be able to manage your overhead. That's one of the reasons why you need 100, 200K right out the gate. So what kind of overhead? Your employees. But start small. Like I was saying with your office space, same thing with your office staff. You don't need to have 5 employees out the gate. You don't need someone at the front desk and 3 MAs and then an esthetician and all this other stuff. That's down the road. I started out with literally 1 employee, and she both answered my phones, and she was an MA. So when I had patients, then she would come to the room with me. You're not very busy in the beginning. So it's totally possible for one person to be handling both jobs because you're just kind of sitting around waiting for patients to come in the door anyway. Your rent, that's going to be a huge fixed expense. So again, if you're renting out an enormous space that you can't even fill with patients, that's a lot of overhead you don't need. So you may want to, again, start small, get a small space that your rent will be lower that way. And find out from the building that you're renting in, do you need to pay for utilities and water and gas and all those other things? Or is that included in your rent? Just make sure you know exactly what your rent is including. Supplies, your basic medical supplies, sutures and gauze and Band-Aids, antibiotic ointment, whatever else it might be that you need, your biopsy supplies, cautery tips, anything you can think of. Just factor those in because you're going to have to get some to start out with. An EMR, that's a big one. And these days, everyone's got an EMR. So you need to look at different vendors, see what you think is going to work best for you. And is it financially possible? How expensive are these EMRs? And we're going to come back to that in a couple of slides again. Phone and internet, you're going to have to be paying for that. IT services, what happens if your computers go down? Do you have an IT company that's going to be helping you through that? Because if you're using an EMR system and you're using computers, which I know all of you will be, you need to know what happens when things go wrong, because then that stops your whole workflow and you can't see patients. Equipment rental. So Do you want 5 lasers right out the gate? Probably not the best idea, but if you're considering at least having one, okay, but find out how expensive that's going to be. And can you buy the device when you're done? Or do you even want to buy the device when you're done? What's the lease payment on that each month? What are the consumables? Do you have to replace a lot of things just to be able to use the device? Who covers the cost of repairs? How long is the warranty? So there's a lot of things you need to think about when you're starting out with an equipment rental. I didn't even have a laser for the first year. I had no devices in my office for 1 year because we just weren't at that volume, and it just didn't make sense to take on that overhead. I waited until I was busy enough and I had enough patients asking, oh, well, do you do laser hair removal? Can you take care of my my tattoo removal? Can you take care of getting rid of some blood vessels, dyspigmentation, whatever it might be? And then website, social media presence. I mean, we live in a very internet-friendly world. People rely on the internet for everything. We all do. So you're going to want to have some kind of a presence on social media because people are going to go to that. People want convenience. They want to be able to schedule an appointment online. They want to minimize how much time they're on hold on a phone call. Everyone's busy. They have a lot of things going on. So that's something else to consider as an expense because you're going to need someone who's running that or maintaining it and making your practice presence known on the internet. So my experience was I broke even with my overhead by about 6 months, and I started taking a salary at about 1 year. I didn't immediately start taking a salary the second I broke even because I wanted to kind of add a little bit more to the pot so there was a bit of a cushion. But about 1 year, that's when I started taking salary. So a few notes on your office space. Are you leasing a space, or maybe it's worth considering subleasing a space? Maybe you're not going to be in an office setting 5 days a week at the beginning because there's so few patients. So maybe you can make a deal with another doctor who doesn't use his or her office space 5 days a week. Maybe they don't use their space for 2 of the days, and maybe you could sublease from them if they're allowed to do that by the terms of their own lease. It might be a lot more economical for you. You share a little bit of overhead with them. Your rent is a lot lower. Again, a way to reduce your costs while you're just getting your feet wet. Excuse me. You know, as you grow and as you evolve, of course, maybe you want to lease your own space at that point, but just in the beginning, something to consider. Again, as I already mentioned, do not get more space than you need. You may want to go for a shorter initial lease term because if you grow very rapidly in the first 3 years, you don't want to then find that, okay, well, gosh, I have a 5-year lease term and we're already bursting at the seams and I can't do anything about it. So maybe you want to go for a shorter lease term, like a 3-year lease term, so that in case you do get so busy that you need more space, at least then you have the opportunity to grow when you're ready to. I think 2 to 3 exam rooms is more than enough to get started with. I don't think you necessarily need more than that. I know a lot of people who started with just 2. I had 3 exam rooms, which I thought was plenty. Again, I think I said Motel 6 earlier, but it was a Courtyard Marriott, but you get the idea, I'm sorry, that you're going for functionality in the beginning. You're not going for luxury and like, you know, this beautiful Instagram worthy office space. Doesn't matter. You're going for functionality. Ultimately, yeah, your patients want to go somewhere nice. Just make sure it's nice enough and it's clean and it looks welcoming enough, but patients want their doctor to be providing good medical care. That's the most important thing. That's why they're coming to see us. All the other stuff is all icing on the cake. And you can get to that when you're ready to and you're able to afford that. But in the beginning, it's about the quality of the care that you're delivering. That's the most important thing. So a few notes on employees. So in terms of how do you interview people, how do you find people? Well, there's of course advertising, word of mouth, talk to your reps. I find that that's very, very helpful. So whoever's bringing you your medication samples or cosmetic samples or whoever you're dealing with, they very often know what's going on in other offices, and they may tell you things like, oh, hey, you know, this such and such office, there's a fantastic MA, she just resigned there, or she had to leave for a different reason, or this MA, he decided that he didn't want to work there anymore. You never know. It's just it's a good way to sometimes find some really, really good employees. Have a good idea of what you're willing to offer. You have to kind of talk to a lot of people and find out, well, what's the kind of going rate in your area for what do you pay an MA? What do you pay a front desk person? What do you pay a PA if you ever get into the point where you need an extender of care? Might not be in the beginning, but down the road. So just kind of know what the ballpark kind of going rates are. You're going to need to create a policy and procedure manual that all your employees have to sign off on, that they receive. This will be true at pretty much any job you go to. But if you're actually running the company, you need to be responsible for putting this together. As I said before, start small. You don't need an army of people working for you because you cannot afford to pay them in the beginning. Just start small. People will multitask. In the beginning, when you only have maybe 1 to 3 employees, everyone should be able to do everyone else's job. Cross-train everyone so that if one person's gone, everyone can still do everything else. You don't want anyone to be in a position where it's like, oh, well, that person didn't show up, so now we're completely paralyzed. Absolutely not. Start small. Everyone knows how to do everything, including yourself. I was never above, of course, setting up my own room, cleaning up my own room, whatever it needed to be done, you need to be able to do that yourself as well. So in terms of supplies and equipment, shop around. These days, I know there are no large conventions like the AAD happening, but those days will return. But it's always helpful to go to different vendors, see what's out there, see what they charge for different things. McKesson is a great source for a lot of the supplies you might need to order. Get only what you need. Think of your overhead. Always, always, always be thinking of your overhead. Contact local reps for medications and cosmetics. And as I said in the previous slide, they're also great sources of information on other practices. So that's always helpful intel to have. As far as EMR goes, said we're going to come back to this. Shop around, just like you do for other things in your practice, because there are numerous options out there, numerous vendors. See what's going to be the best fit for you, see what's going to be the most affordable for you, what's going to make the most sense. Do you want a web-based or server-based EMR? I had a server-based EMR for my own personal anecdotal experience. I, in retrospect, wish I'd gone for a web-based one. At the time, there were very few web-based options, though. The horror story I always tell people is I had a server-based one. I was on vacation out of town with my family, and our server crashed, and we lost everything. And so I had to fly back and work with my IT guy for a week to try to rebuild our server to get all our data back. It was a huge mess. In that sense, I think the web-based or cloud-based system affords you some comfort in that sense and some security. Now, keep in mind, though, the only downside with something web-based, of course, is if your internet goes down, which can happen for any reason, weather or otherwise. If there's an outage, then you're kind of at standstill. So you always need to have a backup plan for how you're going to get through your day. And very often, I would have my staff just print out at least the basic information on every patient for that day. And I would just jot down paper notes on what we did so that once we were up and running again, then we can enter everything in to our EMR. Most EMRs are very expensive. These are not cheap. They are very, very expensive. So again, another reason to shop around. There's the initial setup cost to consider, but then you have to think about other factors. What is the cost per license? So what that means is if you have other providers in your practice, say it's you, then you're going to bring on another dermatologist at some point, a PA, maybe an NP, whatever it might be. Each provider requires their own license to use an EMR system, and they're not cheap. So you want to know how much that cost is up front, so you're not finding out down the road when you are ready to grow that it's going to be prohibitively expensive to get additional licenses for your providers. And the next thing to always be aware of is what are the monthly and annual maintenance fees? And that includes things like tech support for whenever something goes down, how much do they cost? And this can run into the thousands, if not more, dollars. So bear that in mind. You have to factor that into your financial plan as well. It's not just the initial setup cost. There's the potential cost of future licenses, but then there are the current costs of monthly and annual maintenance fees. So find out what those are. And then tech support fees we mentioned as well. And then does your EMR have the ability to be customized? I think that's something really important too. One of the nice things about being in your own practice is the more you can customize your templates and your EMR to how you like to work, the more efficient your workflow is going to be. It might be more work in the beginning for you to set things up exactly how you like. But once you do that, it's fantastic because you tend to say the same things over and over again. You tend to give patients the same set of instructions or advice over and over again. So the more you are able to tweak the system to suit your needs, the more efficient you may be down the road. So you want to know that you're working with a system that affords you that ability. Again, the whole point of an EMR system is it should optimize, not hinder your workflow. So these are just a couple of screenshots of some resources that are available on the AAD website that you can buy straight from their website. And I used these when I started a practice. These are newer additions now. One is starting in marketing a dermatology practice. It just goes through all the basics of what you can think of just in terms of a lot of the things we just talked about, where to practice, how, what supplies might you need, what are things to consider. So that's one resource. And another one, I was talking earlier about how if you're running your own practice, you need to have a set of employee policies and procedures. This is a great resource to use as a kind of a springboard. You can customize it yourself. You can just use the one that they give, but another great resource that the AAD provides. And then an office policy and procedure book as well. Again, also available on the AAD website. So we've covered a little bit of ground here. I know we focus a little bit more on starting your own practice, but I just wanted to come back to some kind of overall general points. You need to first start to think about what it is that you want to get out of your career as a dermatologist, your life as a dermatologist. What kind of a balance do you want between your personal life and your work life? What do you envision for your career? And keep in mind that some of these goals may change. This could be a moving target, and that's absolutely fine. But at least assess what it is that you want at this moment in time before you take this first step in terms of figuring out, well, what do I want to do out of residency? What do I picture myself doing? What do I think is going to be the best fit for me? Trust your gut. I think instinct is something that should never be undervalued. If you know yourself well enough to know that, you know, there is this private practice opportunity to join this group, but I just know I'm going to just be itching to get out and do my own thing, or I know I'm going to have a hard time just not having more autonomy. Well, maybe trust your instinct then. You know yourself better than anyone else does. So maybe then you want to start considering the private practice route. There are risks and rewards in every scenario, as with anything in life. So there's no right or wrong answer. It's just you have to weigh the pros and cons and see what's going to be, of course, the best option for you. And to be perfectly frank, the fact that you're already a dermatologist, this is the career you've chosen, this is what you've trained so hard to become, it is a win-win situation. You are going to have a job. You will be gainfully employed in one way, shape, or another. And we're very lucky to be dermatologists because we are in demand. We have an absolutely amazing specialty. There's so much that we are able to do for our patients. I feel so fortunate to do what I do. So just bear that in mind. You really can't lose. And yeah, you may stumble here and there a little bit, but you will land on your feet and you will figure out a situation that works best for you. And that situation can change. Remember that as well. What works best for you in the beginning might change as time goes along. So that's absolutely fine too. You're always going to have a job. And that's basically it for my talk. I hope this was helpful for you. I know this was a little bit more of a conversational, informal presentation, but the goal again was just to kind of give you guys just a general sense of what kind of options there are out there, some things to maybe consider as you're looking at these different options. And hopefully this was at least helpful in terms of at least getting some wheels moving. And of course, if you ever have any questions, you can always contact me here at Sagis. I'm sure that our media team can provide that information for you. And I wish you all the very best of luck if you're preparing for boards or just going through residency, and hope that everyone is staying safe and healthy during these uncertain times. And thank you very much for watching.